I'm Dr. Audrey Klenke with Pinnacle Plastic Surgery and Bluffton Dermatology, and today I want to talk about breast implants in breastfeeding women. As a mom, I understand the importance of a breastfeeding relationship and wanting to connect with your baby in that way. As a plastic surgeon, I also understand women who have the desire to change the shape or the look of their breast. So my job is to really combine those two worlds and give people some honest information so they can make their own decisions. For patients who already have breast implants in and they have never breastfed a child before, really what you need to know is you just try it like anyone else would try it. In fact, some patients actually do better at breastfeeding with implants in. It's interesting. So I've had moms who've never had implants in that have breastfed children, had implants put in, and then maybe had an oopsie baby later. And some of them actually have better nipple projection and better fullness where they actually establish a better latch with their child. So breast implants being in place actually does not necessarily mean that you can't breastfeed. In fact, it doesn't change the rate of being able to breastfeed at all. Some women struggle with it anyway, regardless of implants or not, based on latch problems or sometimes milk production problems. So the implant doesn't necessarily change that at all. A common question I get is about silicone implants specifically and breastfeeding. And women sometimes are concerned that silicone may leak into their breast milk and that it may damage their baby or harm their baby. And in reality, what we've discovered through years of research is that there is actually silicone in breast milk in all of us, which I don't know if that helps or hurts. It's a little scary, but there is silicone in our natural environment. It occurs in our water source, and it also occurs in implants where we've put it, but there is no increased level of silicone in breast milk for patients who have silicone implants and patients who don't have any implants at all. Another question I often get is if the placement or the position of the breast implant will affect breastfeeding. So for women who might breastfeed in the future or plan to have additional children, it's not necessarily about where the implant is placed, whether it's below, above the muscle, or what's called a dual plane. For me, it's actually more about the incision that's used to place the implant. Traditionally, the inframammary crease, which is the natural crease below the breast, is an oftentimes location used for placement of the implant. Sometimes though, surgeons will choose to place it in an incision around the areola or even in the underarm area. So making an incision around the areola is clearly going to be a slightly higher risk for damaging future breastfeeding because you might be damaging some of the ducts or the channels that come through the breast and exit through the nipple. So I prefer to use an inframammary crease incision for lots of different reasons. I do think it hides better, but also for breastfeeding moms or potentially breastfeeding moms, it's not going to damage any of the structures that come to the nipple. For women who already have breast implants in place and they become pregnant, we all know that breasts are going to change throughout your pregnancy, and the closer you get to delivery, your breasts are going to tend to get larger and change shape and do all sorts of interesting things, but the implant doesn't necessarily affect that. So whatever enlargement or whatever changes you were going to have, the implant is just adding additional volume. And the same thing happens when your breasts aren't quite as full after you're done with your breastfeeding relationship, that the implant's still going to be there, and whatever changes you would have naturally had with your breast tissue and that skin and your nipple are still going to change. So some women don't necessarily need additional surgery. Some women, their nipple position changes and they want maybe a lift down the road. Some women just want a larger or a smaller implant. So none of those things are really affected by your pregnancy or your breastfeeding. Questions about breast pumping often come up too. So breast pumping sometimes is necessary for moms who are on the go, or sometimes they want to provide breast milk but just can't or don't want to establish the actual nursing relationship. And breast pumping can work just as well with an implant in place. And again, depending on the type of system that you're using, sometimes it can actually be easier with an implant in place depending on your breast shape and your nipple position. Because again, sometimes moms have nipples that are depressed or actually go into the body and invert, and a lot of times an implant can actually make those nipples pop out. So sometimes it can make it easier, but it very rarely makes it harder. So pumping should be just the same as feeding your baby with an implant in. One complicated question I'll get is if I already have implants or if I'm thinking about getting implants but I may get pregnant again in the future, Are the changes that my breasts are going to go through during pregnancy maybe going to be less noticeable or less bad if I have an implant in place, or should I wait until after I'm done having babies? And really there's no perfect answer because every body's going to change differently, but certainly during pregnancy and especially nursing, your breasts are going to change whether you have the implants in or not. And what happens after you're done is sort of left to your body to decide. Nobody has a crystal ball. What I often tell patients though is if you know that you're planning on having a child in the near future or even in the distant future, it may be a better idea to wait on implants until after that time. And it's not necessarily because it's harmful or because it's bad. It's more so that the changes that happen and that are completed, I now have a very predictable result. So I know what your breasts look like now, I know how I can change them, and I know they're not going to change very much in the future. So it really depends on at what point in life you are and how sure or not you are that you're going to have babies. But it's quite possible that if you have an implant in and your breasts change because of pregnancies, you might need an additional surgery in the future to make you happy with your breast shape again. There are different types of breast implants. There are saline implants and silicone implants, and it launches into lots of other types of implants. So for example, this is a round silicone gel implant. So you can see it's sort of the same volume everywhere, and it tends to create a lot more volume in the upper pole of the breast, which some women like. But we also have implants that are shaped more like a teardrop, where it's less volume up top, more voluminous at the bottom. These are, like I said, both silicone implants. So I don't have a saline implant here at the moment because they're hard to sort of look at when they're not in the body. And patients will ask about, again, safety between silicone and saline. And quite honestly, as all of these implants continue to evolve, become stronger, but yet still soft, most women opt for a silicone implant because they do feel more natural and they just like the way they look. Saline implants are not wrong and they're still available and I use them. But in terms of, again, breastfeeding safety, there really is no difference between silicone implants and saline implants when it comes to the safety of the milk for your baby. While everyone's personal experience is very different, I can tell you what I experienced as a mom and a mom who nursed 2 little children. So I was certainly much smaller than I am now globally, and I never really had large breasts to begin with, but I'll tell you they were very busy during nursing. I was like a little moo cow and produced tons of milk. I think my daughter was 3 by the time we got through all the milk that we had to buy 2 deep freezers, if that tells you anything. So my breasts changed quite a bit from what they were. And then after the first child, things definitely looked a little bit different, and I was thinking, this is what everyone talks about, that it happened to me, lo and behold. After the second child, things changed, I'd say even more. Certainly not to a devastating degree, but more than maybe I anticipated. So you really just never know what your body's going to do. Sometimes you can look at your genetics and your mom or your mom's side of the family and try to figure it out, but you never really know until it happens to you. So I just advise you not to be too hard on yourselves, because you're giving your child a really important gift and sort of giving of yourself during that time. So go easy on yourself and know that I'm always here to help you when you're done. Our goal here at Pinnacle Medical Group is to provide a premier resource for our local community to optimize skin and global health.